There we go. Hey Asia, how are you? Hello, hello. Y'all, please excuse my voice. I sound like a man today. But nonetheless, I am here trying to do some dosage calculations with you. So if you will double tap in and let me know what program you're in, RN, LPN, BSN, Bridge. I think I got all RNs and LPNs. what program are you in? And let's do some dosage calc. Oh no, where did it go? Here we go. RN, okay. Can you do some intake and output? Yes, I will do some intake and some output for you. I sure will. All right, so hey, I'm Nursey, a blessed RN, and I help thousands of nursing students conquer and defeat dosage calculations. On my channel, I do dimensional analysis. I don't fool around with those formulas because that's less space in your brain you got to take up when you can do dosage calculations a fun and easier way. So we use my puzzle piece method. So what we're going to do is we're not doing any more math from this point on. What we're going to do is see how to solve the puzzle, okay? So when you get a puzzle, it comes in a box. That picture on the box is what your puzzle is supposed to look like once it gets completed. So what we will do is see what our puzzle pieces are. Your puzzle pieces are your medicines, your weights, your volumes. Anything that's together stays together. What's by itself will be by itself. And then we will cancel out of measure so it looks like the goal, which is what your puzzle is supposed to be looking like. In order to cancel something out, it has to be the same on the bottom as it is on the top. Okay? So as we do more and I repeat the steps, you'll catch on to it. If not, just say hey and answer and ask the question, and I'll try my best to get it answered. Hey, Makisha, I placed the order last week. Let me check on it for you. Okay. Thank you for purchasing the workbook. You got an exam on Wednesday. You're expecting a 100. Okay, you can do that, Anika. Because of you, I passed all my math. I'm gonna graduate in May. Oh my gosh! Congratulations, Kim. Congratulations. The nurses are coming, y'all. The nurses are coming. All right, so what I have here pulled up, I just have some random ones. I know somebody asked me to do a intake and output, so I'll find one of those next. But I'm just doing random questions today. Usually I come on Wednesdays at 8 p.m. Central Standard Time. So a nurse is preparing, which is IV piggyback, every 12 hours. Available is 2 grams in 0.9% normal saline. 100 milliliters is to be infused over 30 minutes. The nurse should set the IV pump to deliver how many milliliters per hour, and you're going to round this to the nearest whole number. Okay, so first things first, after you read the question, what is the goal? What is this question asking for me to give it? Milliliters per hour, okay? So our goal, wait a minute. Milliliter on the top and hour on the bottom. Okay, so this is an IV question. For IV problems, you want volume to be infused. So, how many milliliters or liters over the infusion time? Okay, so how long do they want to go over, hours or minutes? So, in this question, you have a lot of fluff. What's going to help you to get through the fluff is the goal. The goal is going to be your very best friend throughout dosage calculations, okay? So, what is the volume that it tells you needs to go in? So, how many milliliters needs to go into your patient's IV? 100 milliliters. Okay? What is the time that it wants you to take to infuse that 100 milliliters? To be infused over 30 minutes. Okay? So we know that we don't need this grams because it's not asking anything about grams. Those grams are in that 100 milliliters of normal saline just swimming around. Okay? So when the normal saline goes in, guess what else goes in? The medicine. All right? And then this every 12 hours. Every indicates a frequency. That's how often you give a dose. Is this asking me how many times per day I'm gonna give ceftazidime? No. I need to know how fast it's going into the patient's vein. So it's never every, it's always over. So this part right here, this every 12 hours is fluff. So you see I have my volume over my time. So my milliliters are at the top right now. I need hours at the bottom. So remember, in order to make my puzzle complete, it has to look like the goal. So I need hours on the bottom. I know that 60 minutes is equal to 1 hour. So now we can cross those out because I put my conversion, my minutes on the top and on the bottom, and now I have milliliter on the top and hour on the bottom. Okay. So once your puzzle is complete, you multiply across the top, multiply across the bottom, divide the top by the bottom. So let's do 100 times 60 divided by 30. 200 milliliters per hour. That's your answer. Did everybody get that answer? Any questions about why we used what we used and what was fluff? No? No questions? Okay. Let's find the intake and output. Drip factor, practice questions, do eyes and O's. This was a little different one. All right, let's do this one. So you calculate your patient's intake and output for the 12-hour shift, 7P to 7A. Okay, so you got all these medicines, right? So the secret behind any dosage calculations problem is knowing your conversions, okay? With your intake and your output, you are definitely going to be converting from cups and ounces, maybe teaspoons, who knows, but everything has to go to milliliters. So once everything is converted to milliliters, you will then add all of your milliliters together. The trick behind the ones that look like this, because you see we've got some IV fluids and some IV medicine, you got a blood transfusion that went in, all that is paying attention to the details. So the time details, because you just want from 7P to 7A, so anything that falls between those times, and then how many times they're giving it or how fast it's going. So you see this first part is from 8 o'clock at night to 6 o'clock in the morning. That's Jevity. That's your tube feeding, okay? So if you've got tube feeding, it's going at 50 milliliters per hour from 8 o'clock at night to 6 o'clock in the morning. So from 8 o'clock at night to 6 o'clock in the morning, that's 10 hours. So we need to see how many milliliters have been given in those 10 hours. And it is between the 7 p.m. and the 7 a.m. time frame. So we're good, okay? So let's do side by side. Okay, so if we have 50 milliliters per hour, of course our goal is going to be milliliters. Ugh, milliliters. We've got 8 hours that this has been going. So we'll put our 8 hours at the top and we'll cancel it out. And that's going to give us how many milliliters? So that's going to be 400 milliliters of Jevity. Okay? So now we've got from 6:15, you've got 50 milliliters of a free water flush. So that's just 50 milliliters, right? So it's already converted. We'll add it to our numbers at the end. So from 9 o'clock to 2:15 in the morning, they got two 250 milliliter blood transfusions. So you see how it says 2? So we'll have to multiply 2 times 250, okay? So that'll be 500 milliliters for your transfusion, okay? So then on at 115, they got 20 milliliters of saline flush, probably flush that blood out the rest of their IV catheter. Okay, at 3 o'clock in the morning, they got a dose of Zosyn. So that's 50 milliliters. That's just by itself. It's just 50 milliliters. At 4 o'clock in the morning, they got another flush, which was 10. And then you see how it says continuous fluids. They get heparin 10 milliliters per hour and normal saline at 100 milliliters per hour. So when it says continuous fluids, it's just going continuously, nonstop. So from 7P to 7A, we know that they got heparin and they got normal saline. So that's kind of like the first one that we did with the Jevity, okay? So if we did heparin, it's going at 10 milliliters per hour from 12P, from 7P to 7A, that's 12 hours, okay? Our hours cancels out, and that's what's going to give us 120 milliliters of heparin. We'll do the same thing for the normal saline. So we've got 100 milliliters per hour going of normal saline. It's going for 12 hours. So boom, your hours cancels out. That's 1,200 milliliters of normal saline, okay? And then ileostomy. Ileostomy, that's going out, right? That's the stoma coming from the ileus. So that's going to be liquid stool. So that's output. We're looking for input right now. And then NG suction. You sucking it out the NG tube. So it's coming out, right? And then urine, of course, you're voiding out. And a wound vac, you're vacuuming it out the wounds, okay? So you have to pay attention to what's going in and what's going out. You don't want to include what's coming out in your input, okay? So I'm going to add all of this together now. So we got our Jevity, which was 400 milliliters. Well, I put times, not add. So then we've got 50 milliliters for our free water flush. We got that 500 milliliters for our blood transfusion. Okay. And then we got 20 milliliters for our normal saline, plus 50 for our Zosyn, 10 more of a normal saline. Our heparin was 120, and then our continuous normal saline was 1,200. So we would get all together 2,350 milliliters for your input from 7P to 7A. Does that make sense? Any questions about how we calculated these? And it's a very interactive live. You talk to me and I talk back. I do have the live going on my YouTube channel. So if you have any questions about it, because, some people are shy, but it's cool. I mean, I don't bite. And I'm very encouraging. This is a very safe atmosphere. So bring all your questions with Dosage here. This is safe, right? But if you want to look back over it after we get done studying, my handle on YouTube is a blessed RN, as it is across all of my social media. And you can watch the replay. Anybody have any questions? No? What kind of questions y'all want to do next? Because I just have random stuff queued up. Y'all talk to me. Let me know. Mm. So this right here is a heparin bolus and a drip. Heparin infusion has been ordered for a patient weighing 75 kilograms. The initial bolus is 1,000 liters of heparin and has been ordered to start before the continuous drip of 15 units per kilogram per minute. You have a vial labeled 500 units per milliliter. The pharmacy has sent 40,000 units and 500 mLs of normal saline. How many milliliters will the nurse administer for the initial bolus? And how many milliliters per hour will the nurse set on the infusion pump? Okay. So, this seems like a pretty complicated problem, but don't let the word bolus fool you. Bolus just means a one time administration of a dose of medicine, okay? So, before you can start the drip of heparin, you need to get that medicine, that heparin in the blood to a place that it's going to go ahead and start working, okay? That is going to keep that blood from clotting because you're giving it to your patients who has had STEMIs, who's got DVTs or some kind of embolus or blood clot, right? DVT, all right? So AFib, that makes the blood not flow right. So when the blood doesn't flow right, what does it do? It clots. So you got to get that medicine at a place in the blood that it's going to work. So that is what's going to be your bolus. So everything that goes with the bolus stays with the bolus. So we've got initial bolus of 1,000 units, right? And then it tells us that we have a vial labeled 500 units per milliliter. So the vial is going to go with the bolus because you're going to draw it up, excuse me, and give it in the patient's vein. The bag is going to be reserved for your drip. So first things first, the bolus. How many milliliters will we give? So we know that 1,000 units is ordered, okay? And we have 500 units per milliliter. Whew. I brought a tear to my eye. Can you do question 15? I have to get my book out, Asia. I'm sick, y'all. Excuse me. I know I've been gone for a minute, so I wanted to hop on, but got choked up. Anywho, milliliters. So our goal is milliliters. We always start with what it is that we're looking for. So this has our milliliters in it. We're gonna flip it over. So ml over 500 units. Units is not a part of the goal, so it has to go to the top. So we'll cancel out our units with our other units. And because it's by itself, we'll keep it by itself. Everything doesn't have to equal something when you have these dosage problems, okay? So now that we're just left with milliliters, we can do the math. All right, so 1,000 divided by 500 is going to be what? 2 milliliters? So that is your bolus. Don't make it harder than what it has to be. Just because you see a word that you don't know, keep what's together together. Keep what's by itself by itself. You did, honey? Let me check my phone. Oh, okay, okay. I just seen it. Yeah, I am. I'm getting better. It sounds worse than what it is, and then I just like started talking, so it just kind of like flared up. But I'm gonna be okay. I'm going to be okay. All right. So now we're going to do the drip part. Okay. All right. So we've already given the bolus. So once it's gone, it's gone. So our goal is milliliter per hour for the drip. Okay. How many milliliters per hour? So we've got our patient's weight is 75 kilograms. What's order is 15 units per kilogram per minute. And then we have 40,000 units in 500 mLs. All right, so First thing is first. Start with what it is that you're looking for. So, what are we looking for? We're looking for milliliters, right? So, 500 ml over 40,000 units times. Now we got units on the bottom, so we need units on the top. I remember why I didn't like this one because it's got minutes on there. That should be hour. So we're gonna change it so we can change it to hours, okay? Yeah, that's too much heparin. All right. So we got 15 units per kilogram per hour. All right. Now our units cancel out, and then our patient's weight is already in kgs. So we'll put kgs over one, and your kilograms cancel out. And so now you have milliliter on the top and hour on the bottom. And that is how you set it up. So you see, we're just putting together the puzzle pieces, canceling out the units because the numbers will be in the position that they need to be in once the units cancel out and you flip them. And can you flip a piece? Yes, you can flip a piece. All right. So it's just looking at what's on the bottom, making sure that it's not in the goal. If it's not in the goal, it has to be canceled out. If you don't have a piece from your problem, then you can use your conversions in any instance. Because sometimes you have stuff and it's like in different units that's ordered than what's available, and you have to use your conversions, okay? So we'll do 500 times 15 times 75 divided by 40,000. 14.06. And if we were to round this to the nearest whole number, what would our answer be? If we were to round this to the nearest whole number, 14 milliliters per hour. Okay? So you just remember on these to keep the bolus with the bolus, keep the drip with the drip. Okay? Bolus just means that that's an initial dose. That's a one-time dose that you're going to be given. Any questions about it? You got a dosage test tomorrow? Oh, everybody got a dosage test tomorrow. Oh my gosh. This is a two-step, yes, because it's asking you two different questions. The first question is how many milliliters for the bolus, and then how many milliliters per hour will you set the pump? You passed. Oh, Arlene, congratulations. Congratulations. I came late to class and they finished going over Reconstitution while you were gone. So for Reconstitution, all you have to do is concentrate on the concentration of the medicine. Um, there's a lot of people get tripped up on Reconstitution because there's a lot of extra fluff in there that you don't need. What you're gonna need is the ordered amount and what is that medicine after they reconstitute it. So let me pull up one. Let's see if I can get one popping. Reconstitution. All right, so let's look at it. You're welcome, honey. I'm so bad at math. I don't know if I'll make it through. Yes, you will. If you know how to multiply, divide, add, and subtract, you can do it. Is there a formula? So, for the last one, you can always use the formula. There's so many to remember. I prefer not to. For the bolus, you could have done desired over half. Um, for the drip part, You would have just had to multiply the weight times the order to get your desire and then put it in the rest of the desired over half. But you really have to kind of be savvy with your math skills to do the formulas. Like with the way that I'm doing it, it's called dimensional analysis. You don't have to be good at math. If you can read, write, arithmetic, you can do dimensional, and you can do all of your nursing dosage calculations. All right, so this one is Reconstitution. Drug X, 250 mg's, IV every 6 hours. Directions on the label state to add 1.5 milliliters of sterile water to a 500 mg vial, which will make a concentration of approximately 225 milligrams per milliliter. How many milliliters will you administer? All right, so what is our goal? First step first. What's the goal? Milliliters, right? So we know that we have 250 milligrams ordered. If it doesn't ask you per day, per minute, per hour, we are just assumed to look for a dose, okay? So we're just looking for the dose. This tells me how many doses are in a day. It's not asking me milliliters per day, because if it wanted milliliters per day, it would have said it. We don't need the frequency. So then, what is the concentration of the medicine after you have added whatever you need to add to it to make it a liquid? That's what you want to use, okay? So, concentrate on the what? Concentration. So, it will give you that. So, 225 mg's per ml. So what's fluff? And if you haven't met me before, I use a lot of my little terminologies and sayings. But fluff is all that unnecessary information that you'll probably try to stick in your question or your equation, and it's not going to work, okay? This is fluff. Important at the bedside when you're mixing medicine, but for the dosage calculations problems, no. This is fluff. This is just simply how much is in the vial. Do we care how much is in the vial? No. I need to know how many medicine parts are in each liquid part, okay? So, fluff. So, my goal is milliliter, right? So, I'm going to start with my puzzle piece that has the milliliter in it. I want it first, and I want it on top. When you start with what you're looking for, you don't have to go and find it. It's just already there. So then you know that everything that comes behind it has to be canceled out. If that makes sense. So we'll do ml over 225 mg's. Okay? Now I've got milligrams at the bottom. I have a puzzle piece with milligrams, so I'll put it at the top. I'll put it over 1 because it's by itself. It's not with anything. It's just 250 mg's, right? So anything that's by itself, we're going to put over 1. That 1 is going to be your placeholder to show you that once your puzzle is complete and you do your math part, it'll go on. So we'll multiply the top, multiply across the bottom, then divide the top by the bottom. So it's going to be 250 divided by 225. Like 1.11111. So if we rounded it to the whole number, it'll be 1 milliliter. If you rounded it to the nearest tenth place, it'll be 1.1. So when you get your answer, don't forget to round how they want you to round, so you get all of your points, and make sure that you label. Okay? Y'all got it? Any questions about reconstitution? What y'all want to do next? What would you like to do next? Okay, let's see. Mm. Let's see. I showed y'all all the answer, but hey, we'll go through it. Alrighty, the physician. prescribes drug M 40 milligrams. Oh my gosh. Y'all asked a whole bunch of stuff while my head was down. Okay, the physician prescribes drug M 40 milligrams IM. The vial of powder states at 8 mLs of bacteriostatic water for injection to the 500 milligram vial to make a concentration of 125 milligrams per 2 ml. Okay. How many mLs equals the ordered dose? So, what is our goal? What is this question asking for us to solve? While y'all telling me to go, I'm gonna go run and get a Halls. Okay, did we come up with a goal? Milliliter, right? Okay. So, what is the order amount? 40 milligrams. So we need that. Okay. What is the concentration of the medicine after it has been reconstituted? Exactly. This part right here. 125 milligrams per 2 milliliters. So, do we need to know about how much water add to it? Nope. That's fluff. Do we need to know how much milligrams is in the vial? Nope. That's fluff. That's what you use. The floaty medicine parts in the liquid. Milligrams per milliliter, milligrams per liter, units per liter, milliequivalents per liter, whatever. Medicine versus liquid, okay? So we'll do 2 milliliters is 125 milligrams times 40 milligrams over 1. You see your milligrams cancel out, so it'll be 80 divided by 125. I think it's like 0.6 some, I don't know. 0.64 milliliters. Okay? So do you see what was the fluff and what's not the fluff? You always concentrate on the concentration. Do a BMI question. I don't know what BMI. I don't know the formula. I gotta look it up. I got the BSA, but I don't hardly ever see the BMI. Do I have any dilution problems somewhere? I gotta pull it up. Let's see. I have trouble figuring out what is really needed and what's not. Use your goal. Oh, thank you, visceral therapy. Use your goal. Your goal is gonna be your best friend. It's gonna help you set up your problem. It's gonna help you pull out your puzzle pieces, and you see it also helps you to cut out the fluff. You want me to do any tips for Hesse or Tease? Amber, the Tease lady or the Hesse lady, that's Jakara Lewis. She does all like that math. Mm-hmm. All right, let's see. Drops per minute. That's not even drops per minute. That was the same one. That one got mislabeled. Uh-oh. All right, let's look at this one. So remember, if you have an IV, you have two ways to give it. One is on a pump, and then one is via gravity, okay? Y'all, excuse me, I had to get a haul. So, either way, you're looking for volume over time. So, the patient has vancomycin, 1,250 mg's ordered once daily for an infection. It's available as 500 milliliters of normal saline and should infuse over 2 hours. Using tubing with a 10 drops per milliliter drop factor, how many drops per minute should the vancomycin be infused? So, what is, whoa, what are you doing, Apple Pencil? What is our goal here? What are we looking for? What if I put 40 times 120, then multiply that answer by 2? Will that still work? 40 was desired. Yeah, that's your desired over halfway. Our goal, drops per minute. When you're looking for a goal, you want to make sure you get everything that it's asking for you to solve for. If it's milliliter, if it just says milliliter, boom, that's just plain milliliter. But if it's milliliter per dose, then you want to do it per dose. If it's per day, put in per day. It's going to affect your equation because you want to make sure you give it everything that it asks for, okay? So we want drops on the top and minutes on the bottom. But either way, this one is it's volume over time. All right. So the goal is asking you for volume over time, right? What is your volume that's in the problem? Y'all let me know in the comments. What's your volume? Exactly. 500, right? What is your infusion time? The time they want to infuse it over. over over 2 hours. Okay. All right. So this right here, this little buddy right here, you're like, well, what do I do with that? Nothing. It's fluff. It's fluff, 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 fluff. You don't need it because that 12,500, well, 12, whoa, 1,250 milligrams is floating around in that 500 milliliters. So when you give that 500 milliliters of normal saline, guess what else is going to go in the patient's veins? This. Did the goal ask you about grams, milligrams, micrograms? No, it's fluff. Okay? We want volume over time. So now we got a drop factor of 10. And your drop factor is always going to be drops per milliliter. So if my goal is to start with the drops on the top, guess what I'm going to put on the top? My drop factor, right? So 10 drops per ml. Now we have milliliters on the bottom, so I need milliliters at the top. 500 milliliters over 2 hours. Milliliters cancels out. And am I finished yet? No, because my puzzle does not look like the picture on the box, which is the goal, right? We've got drops on the top, but we need minutes on the bottom. I have hours. So my last step would be 1 hour equals 60 minutes. So you cancel it out and everything is gone except for drops on the top and minutes on the bottom. Puzzle complete. Now you can do the math. So 10 times 500 divided by 2 divided by 60, which would be 41.6 repeating. So with a drop, you can't divide a drop by anything. It's either a whole drop or it's not a drop at all, right? So therefore, we'll have to round it to the nearest whole number. So our answer will be 42 drops per minute. Y'all got any questions about this one? Thank y'all for liking the live and sharing it and following it. I do have the stream going to my YouTube channel. It's a Blessed Start In, and the replay will be available. I heard you never go over. What you mean? Why not make the 2 hours into 120? Why? My equation is going to do all my work for me. I'm not going to mess up nothing. I'm not going to change anything. I'm just gonna do one equation and let it take place. Just like my weights and stuff, for like when you have to do like the weight based ones and you have to change your pounds to kgs. So sometimes you get like decimals, right? What number you cut the decimal off at? Do you round it up? Do you round it down? Sometimes when you change those numbers, it'll change your final answer too. So you know what? I'm gonna do one problem, one computation, one rounding, one labeling. If you want to change your hours into minutes, that's fine, but that's just an extra step. So whatever you're comfortable with, just as long as you got drops on the top and minutes on the bottom. But with this way, you can see that you've taken care of every single aspect and everything is canceled out. Any more questions? You're welcome. Remember, we did not need this right here because it was fluff. Fluff, fluff, fluff. Like, what? Round down the number because you are technically given zero point 0.4 more of the medication. I'm trying to see what you're saying. Hold on. Let me scroll back up. Mm, 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 mm. Mm, 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 mm. I heard you never go over, like round down the number because you're technically given point 0.4. Well, this case, you have a drop. So you got more than a drop. You need a drop and a half plus a little bit over, right? So with your drop factor ones, you have to round it to the nearest whole number because you can't divide a drop. So whatever way that your program is telling you to give it, then give it. You're not giving more than medication. You're just giving it faster, by over less than half a drop. Okay, would the answer be the same if it was 120 minutes? Yeah, it'll be the same because this right here, this is the conversion. This is just doing converting the hours to the minutes. So in the problem, it'll take care of it for you. So you don't have to manually times it by 60 and then add it in there. This way seems easier. Cool. Are you able to do one more problem? I joined in late. Yeah. Let's do another drop factor. Mm, okay. So the physician orders fluconazole on the counter. Okay. Okay. The physician orders fluconazole 200 milligrams twice a day. The fluconazole dissolved in 250 mLs of normal. Using a drop tubing with a drop factor of 10 drops per milliliters. How many drops per minute should be infused? The goal is drops per minute. Okay. What is your volume from the problem? Because remember, we need volume over time. What's your volume from the problem? 250 milliliters, right? What is your infusion time? 2 hours, right? Okay. So then we've got your drop factor is 10 drops per milliliter. So you always need a drop factor if you're doing your gravity drips, okay? So therefore, I'm going to start with what it is I'm looking for. 10 drops per milliliter, okay? So we'll do 250 mLs over 2 hours because that's from my problem, right? So it doesn't look like the goal. So I have to do my 1 hour over 60 minutes to cancel out my hours. My milliliters are gone, and now I have milliliter on the, I mean, drops on the top and minutes on the bottom. Okay, so 10 times 260 is going to be 20.833333, right? So if we round this to the nearest whole number, it'll be 21 drops per minute. Can you do minutes instead of 2 hours? You can convert minutes if you want to. I just let my problem do all my work for me. But if you want to pre-convert before you put it in the equation, that's fine. If that's what you're comfortable with. Okay? So, what do we not need? This 200 milligrams, because remember it says it's dissolved in the 250 mLs. So once you give the 250 mLs, guess what else is going to be given? The fluconazole. So it's fluff. Okay? Is this asking about how many times we're going to give this fluconazole a day? Nope. Don't need this part either. Okay? Volume over time and your drop factor. So when it's 2 hours, 1 hour cancels out the other, which is equals 1. So when it's 2 hours, they want this medicine to go over 2 hours, right? When we got hours at the bottom, we need minutes. This is just going to be a conversion from your 2 hours to make it into minutes. So 1 hour equals 60 minutes. Hey, love.
Hello, you guys.
Right.
I'm back. I'm the princess.
Ma'am, could you not do that? Stop.
I'm so gorgeous.
Can you not do that? Stop. Goodness.
They miss me already.
Could you not do that? Stop. All right. So, what I was saying before, I was very rudely interrupted. Little rude self. This is your conversion. It's just your conversion factor. It's just what. This is like your metric conversions, how something equals to something. 1 hour equals 60 minutes. Like 1 day is 24 hours. It's just to make sure that your puzzle gives you exactly what it is that you need. Because we know what's on the bottom has to go on the top and cancel out. And it comes like in handy when you're doing your long weight-based problems too. Don't encourage her, Ashley. Y'all want to do one more? Okay. I have videos of this on my YouTube channel as well. A blessed RN. So the replay will be available after we study. I'm not even proud of this one. Because I sound like I'm like half dead, and then I got my little child coming in here interrupting, but it'll be up there. But if you just want to do a review on just like drops per minute, milliliters per hour, weight based, I have all this stuff on my channel, a blessed RN. So the patient has Levaquin 500 milligrams ordered once daily. It's available as 150 mLs in normal saline and should infuse over an hour. Using the tubing with 15 drops per milliliter drip factor. How many drops per minute should the Levaquin be infused? So once again, we're looking for drops per minute, right? So we know we need a drop factor. That's a puzzle piece. All right, what is our volume? What is our infusion time? So that's volume. It's going over 1 hour, right? So I know I got 150 milliliters that needs to go over 1 hour. Is it asking about gram, milligram, microgram? And then we've got milliliter on the bottom. So I know I need my milliliter at the top. That's how I know what comes next. Whatever's on the bottom and it's not that, I know it has to cancel out. So it'll be 150 mLs over 1 hour. I've got hour at the bottom. I need minutes. So I can convert 1 hour into 60 minutes. And it cancels out. Now I have drops on the top, minutes on the bottom. So we'll do 15 times 150 divided by 60. 37.5. So if we round it, let me close the door, y'all. Hold on. So if we rounded this to the nearest whole number, we would get 38 drops per minute. Okay? Hey, you just followed? Cool. Thank you for the follows. And you see, it's not math. It's a puzzle. You can do all of your problems. It's a handful of problems that's dosage calculations that dimensional analysis doesn't work for because they are formulated formulas. And that is your BSA, your Parkland burn formula, and your fluid volume maintenance for your pediatrics. But there's still easier ways to do those too. I think what will confuse me is the time. Well, if you need to convert your time, go ahead and convert it. Just make sure your minutes are at the bottom and your drops are at the top. Some safe dose? Yeah. Safe dose. Safe dose. Safe dose. Let's see. This looks okay. It says drop per minute, but it's safe dose. Um, your dimensional analysis looks so easy. Yes, thank you. That's what it's supposed to be like. Because dosage calculations don't have to be hard. I'm telling you, if you can multiply, divide, add, subtract, you can do dosage calculations. But when I'm converting it, it doesn't come out the same. What do you mean? The numbers are in the same position that they would be if you were converting like 60 minutes times 2, which is 120. So it should be the same. You got a test Friday? Okay. Everybody's got a dosage test this week. When you are converting, when do you multiply and when do you divide? Tiffany Day, can you give me some more to this question so I can answer it? Because I'm not sure what you're asking me. Okay, in the meantime, safe dosage range, okay? So, I'm going to pull out my colors so we can talk about some things. All right, so let's read it. The provider orders drug A, 300 milligrams by mouth every 8 hours for a patient who weighs 75 pounds. Recommended oral dose is 20 to 40 milligrams per kilogram per day in divided doses every 8 hours. The maximum dosage is 2 grams per day. How many milligrams per kilogram per day is the patient receiving, and is this a safe and therapeutic dose? Okay, so this one is a little different from your normal safe dose range problems. So this one is asking us how many milligrams per kilogram per day is the patient receiving. Okay, so that's going to be our goal, and there we need to see, is it safe and therapeutic? So we know what's going to be safe and therapeutic is between these numbers right here, 20 to 40 milligrams per kilogram per day. Okay, so what we'll need to do first in this case, because we need to know how much is ordered as milligrams per kilogram per day, then we'll see, does it fit in here. So milligrams per kilogram per day is our goal. Okay, so 300 milligrams, that's one dose, right? By mouth every 8 hours. So if you have a dose that is supposed to be given every 8 hours, you give it every 8. So 24 divided by 8 would be 3, right? So in one day, there are 3 doses because we need to figure out for the whole day because 300 milligrams is just one dose. I know that there are 3 doses in the day. And then my patient weighs 75 pounds. So I know I've got to have kilograms in there, right? All right. So how am I going to set this up? I'm going to be looking for my milligrams at the top, my kilogram, and my day at the bottom. I'm not going to use any type of math. Watch this. So this piece right here has my milligrams in it. That's the first in the top goal. You always do your top goal first. Keep your goals first. They're your top priority, right? That's how you can remember. So 300 milligrams is one dose. Okay? Now I need dose to cancel out because I need kgs and day at the bottom. So what needs to come next is dose, so it'll cancel. So this has doses in it, right? I'm just going to flip it so it's at the top. So 3 doses are in one day. Boom, boom. So now I've got milligrams at the top. I've got days at the bottom. But now I need kilograms, right? So my patient's weight is in pounds. Am I going to touch it? Nope. I'm going to let my my one problem do all of it. I believe in picking up my calculator one time, okay? So I need kilograms at the bottom, but my patient's weight is in pounds. So I know that 1 kg is 2.2 pounds, right? So now I've got my kilograms at the bottom, and I'm going to put my pounds right here at the bottom to cancel out with my pounds at the top. Now everything is gone except for my goal, which is milligrams at the top, kg at the bottom, and day at the bottom. So you see it's just putting together a puzzle piece, okay? Now I can do the math. So we'll do 300 times 3 times 2.2 divided by 75, which is going to be 26.4 milligrams per kilogram per day. All right. So this right here tells me that the safe zone is 20 to 40 milligrams per kilogram per day. So that's the green part. Anything less than 20, anything more than 40 is not safe, okay? So we have 26.4 milligrams per kilogram per day. Is that in the green zone or is it in the red zone? It's right here up in the green zone, right? So that means that it's safe. That's what y'all need before y'all test because y'all be stressing out. It's nothing but tea. It's not Ativan for real. All right? Does that make sense? Anybody have any questions? Okay, Tiffany, you're talking about if you're going from grams to milligrams, I would divide, and the opposite would I multiply. So remember, when you have one big thing, right, and you making it smaller, you got a whole bunch of little things to come together to make one big thing. So like 1 gram is 1,000 milligrams. So if you're going from 1 gram to something milligrams, you need a lot of little pieces. So you multiply it. So then if you're going from a lot of little things to one big thing, then you're going to divide it. Right? So that's how I remember that. Okay? Any questions about this one? This one was a little different because they asked you to find the milligrams per kilogram per day. Usually you just have to find like the milligrams per dose or whatever. I'll see if I got another one to show you. But that's the thing. You always just see what it is that's green, what it is that the question wants, and where does it fit in there. Okay? So, I guess this one looks okay. Let's see. A child weighs 28 kgs and is to receive Med B 0.1 grams IV every 12 hours. The recommended safe dose range is 10 to 20 milligrams per kilogram per dose. What is the safe dose range? Is the ordered dose safe? Okay, let's break out the colors again. All right. So this one is more like your traditional safe dose ranges. Okay. So if we have the order, which is this is not what we want to touch first because we have to find what is the safe dose range. Okay. So what's green and what's red? All right. So it says what is the safe dose range? And you see that I've already got dose in my safe dose range. So I'm looking for how many milligrams per dose is safe. So we know that 10 is the least, 20 is the most, okay? So 10 milligrams per kilogram per dose is the least amount. 20 milligrams per kilogram per dose is the most. And then our patient weighs 28 kilograms. So our patient's weight is already in kilograms. So if you have not been here, you came in on the tail end. The goal is your gold standard, okay? That's what you want your equation to look like because that is what the question is asking you for, okay? All right? You want milligrams per dose. So the units of measure that you want in your equation are milligrams, and you see how they're on the top? That's where they need to be at. Dose is on the bottom. That's where it needs to be at, okay? So I always start with this top unit. These are our puzzle pieces on the side. So we got to do two separate problems because we got to find the least that they can have. Then we got to find the most that they can have. So if I'm going to start with this 10 milligrams per kilogram per dose, you see my milligrams are on the top. Kilogram and dose are on the bottom. So look, milligram is already on the top. Dose is already on the bottom. Only thing that needs to get rid of is kg. Okay? So, how are we going to get rid of the kgs? Our patient's weight is already in kg. What's on the bottom has to go to the top. It has to be the same unit of measure in order to cancel out. So 28 kilograms, and it's just by itself. It doesn't equal a day, doesn't equal doesn't equal stop it.